Hello, and thank you for inviting me to this from the Planning Committee. I really appreciate having the time to talk. As she said, I'm from the Division of Aging Studies at Wichita State University. And today I'm going to talk about three topics fairly quickly. We're going to talk about older adults in general, ageism, which we'll talk about more later today, I believe, and the current research. To begin, this is how I conceptualize research for any topic. So in this case, it would be health literacy and older adults. First, I look into the literature to see if there are solid definitions of the term. And then I look to see if there are survey or measuring instruments that have been validated and are reliable. And third, I start to look at the interventions, and hopefully we'll have a randomized control trial by the end of all of that. I think you've all probably seen this. This is the definition that I'm going to use for today. It comes from the IOM in 2000. According to Sorensen in 2012, there are currently 17 definitions in the health literacy realm for the literature under peer-reviewed journals. I fall back to this one because it seems to have the main constructs of all the other definitions. And so it's to obtain and process and understand basic health information in order to make decisions. According to Knowles in 2003, the older adult population is estimated for only having 3% of older adults who are proficient with health literacy skills. I believe this stands today, but has not been remeasured recently. And there are different age-related changes that contribute to the decline of health literacy over time. They include some cognitive abilities, physical abilities such as hearing loss, vision loss, or even cognition, psychosocial issues, and finally, shame and embarrassment for human beings. We all see this, and we see it very well within the literature for this group as well. The good news is that there are people out there hoping to collaborate and create information about health literacy for a population level. This health literacy network started with a group of people from Missouri, Nebraska, Kansas, and Arkansas, and as you can see, has spread to different states throughout the United States. Most recently, we worked with the CDC to get a 3-question screener available to all states in the BRF-SS, or Behavioral Risk Factor Surveillance System survey. We call it the BRFS. And it's available now to every state that runs the CDC survey. Kansas has the measures for 2012, 14, 16, and 18. And in general, we're finding this for our state. We have about an 8% low health literacy rate. But what I'm really interested in is the high health literacy, or those educated people who are able to, in some way, with some benefit, navigate through the healthcare system with more ease than those with low health literacy. Now I'm going to talk a little bit about the older adult groups. Older adults are typically thrown into a bucket of age 65 and older, and this is arbitrarily set by researchers. And we didn't locate any studies that used what I'm going to show you next as the 3 more detailed, insightful groups for this age. So first, there's the young old, and these definitions change depending on who you look at for research. The young old, which is 60 to 69, the middle old, which is 70 to 79, and the very old, which is 80 plus, or the young old 65 to 74, the middle old 75 to 84, and the oldest old, which is 85 plus. So those are a couple of the definitions we use when we separate out over 65. Some other good news is that we have measuring tools. I'm using this from Terry Davis in 2010. She created this for us. Thank you, Terry. And it shows that we have a number of tools. These are not all of the tools available for measuring health literacy, but just to take number 1, the RAT3, this was used actually in psychology first to test cognition. It's the most cited health literacy assessment. Typically, people are using the Realm, TOEFL, and S-TOEFL for measuring health literacy in the older adult groups, but there's a list there, and they're listed by number of citations. And we have the single item screener. This came to us from Lisa Chu, and she had a 3-question screener. Modifications have been used for this for the CDC survey that I just mentioned earlier. And it may be that this one question is a good litmus test or back of the envelope, which would indicate a need for further assessment. This is from our study in 2016. We looked at a literature review. It's a little dated now because we looked at articles from 2000 to 2014, and it was published in 2016. And what we found that no study reported a validation of any assessment tool for health literacy in the older adult population. We used the single item screener and the S-TOFLA to kind of see how they compared, and we had mixed results. Should note that the sample size for that study was only 69, so we have more work to do. And the validation of standardization of tools could be key for integrated health literacy screening in the primary care setting. For ageism, we know a little bit about just from Merriam-Webster. It's discrimination. Can't hardly say anything further about that, but it's prejudice or discrimination against a population just simply based on their age. So we looked in the literature and found publications from 1986 to 2017. We searched in PubMed. PubMed only was the only database that we used for this cursory screen, and we only looked at U.S. studies. These are the search terms that you can read: ageism, older adults, elderly, geriatrics, and aged, and we only found 38 articles with all of those search terms. And the majority of those 38 articles fell into one of 3 categories. That would be teaching about ageism to or assessing ageism for nursing students, physical therapy students, and medical students. The second group, quite a bit smaller, was talking about older adults having, or adults having discrimination against older adults. But the third bucket was really curious to me because it was, the research talked about older adults, so those over 65, having prejudice against older adults. So within group prejudice. Now typically this would be somebody who is, say, 67, thinking about the prejudice of someone who is 85. And as you delve deeper into the literature, you find that it really has to do with death. Most of the literature was surrounded by death theory of some sort. But today, our team was not able to locate any articles on health literacy and ageism, so that category is wide open for research. Also, we just finished up an ageism and knowledge study. This was a pilot study that we conducted to look at whether a relationship exists between the level of knowledge of aging and ageist attitudes. We had a convenient sample of students enrolled in fall for Wichita State University, and we used these 2 reliable, validated tools called the Faboni Scale on Ageism. It has about 25 questions, and the Palmer Facts on Aging, and it has about 35 questions. We had 123 responses. They were mostly women, with a wide range of age, but they were white, and the majority of them were seniors in undergraduate studies. So overall for our findings, the score of knowledge was low, and the possible score is 0 to 25. And most of these, in fact, 64%, were health professional degree students. Overall, the attitudes toward older adults, the attitudes were positive with a neutral score of 57.5. So our results indicated a significant negative relationship between knowledge and ageism, or the more positive attitudes the student had, the greater knowledge that they had. And a significant negative relationship between age and ageism was also found, or implying that positive attitudes in students of greater age. And now I'm going to talk about the current research that we have on health literacy and older adults. The landmark study that we really need to keep in mind, this is an important study that I fall back to when I'm thinking about health literacy in older adults, was from Baker back in 2000. It's a really important study in that they used the S-TOFLA and a mini mental status exam, so they threw a cognition test in there. They have a really great sample, over 2,000 participants. But what he found was that the F-TOEFL scores declined for every year of increase in age. And then they adjusted for ethnicity, race, et cetera, all the demographics information, and it held true at just a little bit lesser rate. And then they adjusted for the mini mental status exam, and again, it held true that low health literacy declined with increase with every increased year in age. Now, there were differences in newspaper reading frequency, visual acuity, et cetera. So at WSU, we ran 2 studies in this area. The first, we used the births data, and we looked at some cognition questions that were included as a part of the survey, and the 3-question screening tool for health literacy. And what we found was that having high health literacy or moderate health literacy after the age of 65 decreases with each subsequent year of life. So very much confirming what was found in the previous study. And cognitive decline alone was the single most important predictor of health literacy in older adults. We also did updated our systematic literature review. We looked at articles from 2000 to 2017. Again, we searched in PubMed only. This is just a refresher of the publication that you all have. And we looked at these search terms: older adults, elderly, oldest of old, and geriatrics. And what we found was 1 textbook and 127 total published articles. Again, I want to say this was just one database. But there were 0 publications that had oldest of old in their title. So there's still having a lot of opportunity to do research that breaks the oldest of old or whatever down into the 3 groups. So by year, what we had was 2000, 2005, there were 3 publications. Then we see in 2006 to 2010, that 5-year period, it blossomed to 26 publications, and that's where the book came in. Then in 2011 to 2015, we have 59. So again, more publications in the area. And then there's just 1 year hanging out there for 2016 to 2017, and we still had 37 publications. So we had a total of 127 publications in this area, but it's grown over time. So we broke that down a little bit further for the systematic review. We started with 127 publications, and we excluded 98. So the first exclusion, or the primary practical screen, was we removed any studies that were not conducted in the United States. And then we kind of gleaned through each of the articles to find, were they indeed having a population of 65 and older? And 59 of the studies did not. And then we excluded the book as well. So we had 20 studies remaining. And of that, we did a methodological screen. So we looked at, were they a tool development study? Mental and financial health are actually measured differently, so we pulled those out. There was a commentary, a case study, and 1 article that we could not get hold of. So we had 10 articles left from the entire pool. We looked at what measures were being used, and again, I might put out there that no tool has yet been tested and validated for older adults. So we're still using the same tools, but not quite sure if they're valid for this population. And as you can see here, the REALM and S-TOEFL and TOEFL, even the SALSA, those have all been validated. CAPS is a little bit different because it's on patient satisfaction. And some studies use 2 of the tools within 1 study, so maybe they use the REALM and the S-TOEFL together to measure health literacy. But in the end, we found that there were no articles testing interventions with participants over the age of 65, and there were no articles that broke the analysis into the 3 groups for older adults. So here's where we are now. The majority of articles that passed the practical and methodological screen were assessment studies. We're not quite to interventions. And the case study did test an intervention with geriatrics, but it was really a case study, so we separated it out. And right now, according to us, what we did for our screen, we found over 190,000 articles have been produced on health literacy. So if you look at the health literacy in older adults in comparison to health literacy in general, there's a lot of work to be done. Here are the 10 articles that we ended up with if you want to review them. that met the qualifications for health literacy in older adults publications. And I have a little bit of time for questions. Do you question? Okay, great. Then I'm done.